Have a good day for all the viewers. Today we are in Colombo, Kalubowila in Sri Lanka. We are going to talk to Dr. Kamal Gammampila regarding some big issue which is happening in Sri Lanka. In terms of health, the kidney disease has been identified as one of the major problem which related to agriculture. So Dr. Gammampila is a biomedical scientist and who has been doing research on this issue for a long time. And we are here with him today to talk about this the health problem and also related other matters. Doctor, can you tell us about the problem in Sri Lanka and when it has happened and also your view on the issue?
In early 1990s, around 91, 92, a new type of chronic kidney disease was identified in Anuradhapura. Typically, kidney disease is associated with high blood pressure and diabetes. This is without those, hence a new type of kidney disease. Over the years, it has the number of people and the land area that is being affected has expanded, covering almost all the places north of Mahavali, we might say, in one direction, and in the other direction, the southeast dry zone, in effect, the whole of the dry zone. But within the dry zone itself, there are patches of areas. Among the high incidence of kidney disease, there are these spots have no kidney disease, or for that matter, any other disease. Although we concentrated on kidney disease in the past, now we know that in the same communities, in the same areas, we have thalassemia and cancers, various other conditions at very high levels.
Okay, doctor. Then in that case, the viewers might be wondering what's the relationship with the agriculture and also thalassemia and also cancer and all the other related disease. So what's the difference between the thalassemia and this so-called chronic kidney disease?
They are two different diseases. But the thing is, typically thalassemia is a genetic disease. But genetic diseases can be triggered by what are called environmental factors, such as toxicants, for example. Those who did the thalassemia study in Sri Lanka did not consider those factors at all. They are factors which have been well known among the scientific communities, even the lay people, for a long time. And their publication was in 2017, so it's fairly recent. And for them to have omitted that is a major mistake. And in fact, we should consider that study invalid because there is the possibility we may be treating conditions claiming they are thalassaemic or thalassemia, but they really are not.
So that means, doctor, even though they identified the disease as thalassemia, that is not really the thalassemia, but it is very much, its symptoms are like thalassemia, but the cause is the same as the kidney problem.
Absolutely.
And also, doctor, what is the cause for the kidney disease and how this has been happening and what are the evidence that the agriculture has a direct relationship with kidney disease?
We know in the past it was known that cadmium was the main chemical for causing chronic kidney disease, and that's been known for a very long time. And that no one can dispute because it was found out in the case of an accident in Japan, where in gold mining they used cadmium-based chemicals to purify gold, and as a result, people who used that water for rice cultivation became ill. So only cadmium was involved there. So we know that cadmium definitely is an agent that can cause chronic kidney disease. But we now know lead, for example, is also a chronic kidney disease causing agent. And lead is so toxic to human being, so much so that there are no international safety limits. For cadmium, there are safety limits. Lead, there aren't any safety limits as such. Idea is to avoid it as much as possible. And when one is exposed, there are procedures one should follow to minimize the exposure or if possible to try to remove it.
So doctor, how does the cadmium and arsenic get into the food.
Main source is the rice. For example, what's called the WHO study ended in 2013, done with the Sri Lankan government and the WHO in collaboration, that found out that in our rice, in our vegetables, in our drinking water, in our urine, heavy metals are present: arsenic, cadmium and lead. And lead and cadmium are identified chronic kidney disease causing agents. Perhaps arsenic too. And there may be other agents too. But these facts were known for a long time now. And hence we got to say these are the agents that are causing chronic kidney disease. Why is it in the dry zone? Dry zone extends from the kind of a north of Hawdana River in the central area and in the southeastern area right down to Hambantota, Matara area. Hambantota, let's say Hambantota. And we've got kidney disease, thalassemia and all the diseases in the complete polar dry zone. And also northern regions too, they are also within the dry zone. They are there too. The slight difference there is, now in the dry zone, we do rice cultivation with hill country water. Hill country water has tiny quantities of these chemicals. Possibly it has glyphosate, etc. too. In the WHO study, they found 11 glyphosate-like chemicals in the urine of our Rajarata people. How did it get into the body? We haven't done any studies to find out. And from studies elsewhere, we know that glyphosate can be in food. And we haven't done those studies. But we have heavy metals. Now we drink hill country water in Colombo, hill country water in Kandy. However, if we use that water, because of the fact that rice cultivation requires large amount of water, what we refer to as rice water footprint at 3,000 to 5,000 liters per kilogram, extra dose of toxicants is available to the rice plant through this water. And through a process called biomagnification, rice plant gets more toxicants and rice grain also gets more toxicants that way. This is where the real problem lies. These are the fundamentals we need to understand and reduce.
Okay, doctor, then that way, like most of these heavy metals and all the other agrochemicals, maybe pesticide, fungicide, weedicide, and all that, what they use in the upcountry, trickle down into the low area in the dry zone, and they accumulate there, and through the paddy they get into rice, and that is the main reason what you recognize.
Yeah.
And also, doctor, now what is the history? Like, when was the kidney disease person found, and is there any correlation to the turning the upcountry water through a Mahavalley scheme? What is the relationship with the chemical getting into the hill country water, and then they are coming down into the mid country and also accumulating in the dry zone?
In Sri Lanka, chemical fertilizer was first introduced in 1959-60, that period. And naturally today have been applied in hill country, that is plantation, to start off with maybe. And in Anuradhapura, when they found the first kidney disease without diabetes or high blood pressure, it was 1992. Now that's about 1992, about 32 years later. But the thing is, dry zone or Anuradhapura area did not get hill country water for rice cultivation until the irrigation schemes were started, which happened in 1976 with the Polgola Tunnel project. And so it's not a strange coincidence that the first people were found in Anuradhapura, because the Polgola Tunnel waters were delivered to Kalagawa and then through Malwatu, etc. to Anuradhapura area. So there's a very countable link there. And also in other places such as along Winnipeg Canal, at the very beginning, after the last hydro reservoir, within about 5 kilometers, in the first agricultural village, I came across 4 people in a place called Kolonyaya. This is in 2018, that period. And in the adjoining village, one of the villages, Ambaga Palace, there were 46 people receiving benefits. That's the way you can find out, because the government doesn't let anyone know the number, and that is good enough, I would say. And similarly, when you go further down Minipa Canal, when it comes Hettipola area, where Hinganga, that originates in Knuckles, joins Maha Valley, we traveled Hinganga through the jungles, etc. We came across a single person in an area that could be, I didn't think it was chronic kidney disease due to this reason, but a kidney patient, but only one. And until we came to the last village, in that village, we came across two brothers, one a kidney patient, other not. Elder brother is non-kidney patient, and he was very healthy, and he used Hingaga water for rice cultivation. And the younger brother used Minipa Canal water for rice cultivation.
There, doctor, it's very clear that the hill country, the person who was getting hill country water, who was consuming that, has the kidney disease and other not. So it's very clear that the disease is having something very much connected to the upcountry water. So doctor, also now we have been hearing and studying some of your research studies. How does this chemical accumulate in the body, and how does it travel to generation, because sometimes the mistake by people can think about is that the thalassemia is a genetic disease, so the kidney disease and also the other symptoms are also transmitted from generation to generation. Can you explain how that's happened?
Yes, indeed. These toxicants are stored in the blood, or it's in the blood, tissue, muscles and soft tissue, as well as in the bone. Our idea is that what's in the blood is recent exposure, and what's in the soft tissue may be recent and in the past. But in the bone, they remain in the bone for about 30 years. One of the mechanism is that what is in the bone can come out of the bone when a person is pregnant with a baby. Because our bones are made with, so to say, mother's bones, material from the mother's bones, what's called osteogenesis. And when that happens, what is in the mother's bone can come out. And it is likely through that source, the baby in the womb could be affected. Even if the mother had been free of toxicants for a long time, even if the level in the blood and soft tissue are low now, still there could be issue there. That way, when it comes to the next generation, baby born to a mother like that, also who has blood and tissue levels, at least high or considerable levels of toxicants in the body through their own diet, when they become pregnant, they may have a dose enough to pass some on to their own child in the womb. And this child probably will get exposed in the womb as well as through the mother's milk in their very early life, and through family food thereafter till they are married to. And by then, when they come to marriageable age, so to say, their toxicant level could be higher than their own mothers.
So this is, doctor, very alarming, and because the way you explain that it is transmitted from mother to the child and from child to her child, and like this goes from generation to generation. And so what is your estimate, like how long this will take for even the medical practitioners or the medical ministries in order to recognize that this affects, and also that as a serious issue where it can really affect the mankind and the humankind and also the civilization?
So far, successive governments have not addressed it. And even if we have to address it now, we need to do it in a different way now. Others, some understood the problem, but they couldn't do much. And some others understood the problem very well, but they decided to cover up, or thought they might have different answers, but they didn't work. They thought by controlling the water, giving clean water, we may be able to solve this issue. We have failed, we know that now. And the point is, from water, both drinking and cooking water, the exposure is only about 10%, in fact less than 10%. From rice, it can be between 50 and 75 to 80. And from vegetables, 25 to 35. So in that circumstance, controlling water only might shift it a little bit, but it is not a solution.
So doctor, in that case, like not only people who is in the dry zone who is eating this rice can have the problem, and also we are living in Colombo. So what is the impact on us if we also eat the same rice?
At the moment, we get about 65% of the supermarket rice from the dry zone. And in the dry zone, say for example, Ampara, those two depend on SriLanka Samudra for rice cultivation. There are no diseases there because their water is not contaminated with hill country water. And also around the SriLanka Samudra area, there are jungles. Although I understand they are being cleared now, and which is a grave mistake for agriculture. And if we did that, those people will also fall ill. Anyway, going back to Colombo situation or supermarket situation, so you get from Ampara very clean rice. And what comes to Colombo, it's a mixture of bad rice and toxic rice. And also in Rajarata itself, not all the paddy fields are toxic as yet because some of the irrigations are coming into force now. So they would have cultivated at least one kanda earlier. And now they will begin to do 2 crop cycles and they will introduce toxic rice to the market. And gradually Colombo rice will also go up. And we will then see a real impact if we don't begin to address it now. Although in Colombo, there are no epidemic scale diseases. We know that what's called AKI, chronic kidney injury, that is people getting sudden kidney disease, is happening. At a low level, but it's happening. So we could say these are the beginnings. When doctors begin to notice these things, they are not in the very beginning, but gone into the process as such. So we got to be aware of this now and begin to address these issues now without waiting 20 years. Then it's too late. And for dry zone people, for many, it's too late now. But we need to salvage. It is not an issue of curing people, protection and salvaging. And these things must happen as soon as possible. I might say there is a sociological problem here too. These are rural people and poor people. Their knowledge base is not high on these matters. They are kept in the dark completely. For example, most of these community people don't have a mobile phone. They do have a mobile phone, but not
Access to internet.
not access to internet or a modern phone.
Yeah.
And those things are necessary now so that they get whatever information they get. And also the agencies must use that as a tool to educate on this subject too. And these are necessary things. And because they are rural, humble, we have been taking advantage. And that has to stop.
Doctor, also now there are some data or information which is interpreted in like the health department and certain publications. And when you look at the cancer, and we can see in 2006, I think, there was a drop in
2016.
2016, there was a drop in all kinds of cancers. So, but we know as a general public, we get to hear our relations, the families and friends are getting sick more and more. They are getting cancer, they are getting kidney disease and all the unknown diseases like thalassemia and the blood cancer and the breathing problem and all that. So certain authorities or certain people are trying to say that they are in the decrease. What is the reality on that?
WHO study in 2013 showed us the fundamentals. A single study can't answer all this. They showed us the way to move forward. For example, Sri Lanka was asked to do what's called diet study. We haven't done that yet. But some scientists have done these studies in certain areas. There are 2 major studies by very senior scientists of the country, and they are being ignored. On the other hand, following the WHO study, we began to hide the fact. It is unclear exactly why, but at the time. But now we know because of that hiding, it gave opportunities for other people with vested interests, such as fertilizer suppliers, even the people who produce fertilizer overseas, to get involved in this, to deny the link between agrochemicals and these diseases. Perhaps the same people are involved in all these matters now. They have infiltrated our system to the extent that even in the Ministry of Health, what's called the National Cancer Control Program. When you look at their data is manipulated to show that cancers are not going up as fast as they ought to. In fact, they show in their graphs, which is on the website, that nearly all the cancers go up or down, at the same, these the years, at the same year. That cannot happen with cancers. Maybe with vegetables, for example. In a certain area, all the vegetables might have a good yield one year, next year go down. But with cancers, that cannot happen. Furthermore, they show that all the cancers go down in 2060. That is impossible. So this is how they manipulate the data to hide the facts. These have very serious consequences for us. Another thing is, adult cancers are caused by what's called a lifestyle. One's diet, one's occupation maybe, they inhale bad fumes, for example, otherwise alcohol consumption and type of food they consume. But when it comes to below 19, they are caused by the mother. By mother exposing the baby in the womb, so now the childhood cancers are going up. We know that, whatever statistics say, we know that. And that is happening because of the mother exposing the baby. For example, some people who will fall with cancer today, a 19-year-old say, probably that person's mother was exposed for 20 years or before. So to control what's going to happen in the future with children, we got to control the safety of the mothers or the safety of the baby in the womb by looking after the mother now. And for that to happen, since the mother can build toxicants, that should be done another 20 years before perhaps. So these are long-term problems, but we got to be alert to these things now without waiting another 20, 30, 40 years or more to say, gosh, we got a problem here. Then it's too late.
Doctor, now there are some data interpretation and studies results where they were trying to do samples in different areas. For example, dry zone, intermediate zone, wet zone, and upcountry and low country, and to show that there is some other correlation. So, can you please tell us whether that study has been designed in a proper way, or whether there is some intention behind formulating that study to say something else rather than the truth?
As I said, there's a large effort being made to hide the truth by various parties. For example, when we look at the recent report, that is to do the World Bank, what's called the World Bank funded agricultural policy, and also the impact of heavy metal impact on the health of these people. And these are major omissions. In that study, one of the publications he made under his leadership, someone called Saranga Diembalaganaki, has large number of errors, and it cannot be said that they are mistakes. Their attempt has been to show that there is no link between hill country and the dry zone diseases, and also this is an issue of climate. So their study covered 3 zones: wet zone, intermediate, and the dry zone. And when they took samples as in the map, they took a small number of samples from north central and northern areas. That's where we have the highest level of diseases. And they took 27% of the samples of the dry zone from Ampara area. Ampara is a large district, but the samples, when you look at the map, one sees that they are taken from the SriLanka Samudra fed area, where there's no kidney disease. And also they took samples from Karutara area. And kidney disease is there. There are paddy fields irrigated with Kaluganga waters that come from Ratnapura, and they bring toxicants with that. And that is why these people got kidney disease, and not because that it is in the wet. And equally, they fail to take samples from places such as Galle. There are in the wet zone no kidney patients. So these are not scientific studies. These are studies designed to mislead people. And those studies must be rejected by the government. And I have asked the government and the WHO as well as the World Bank, for example, to do that. I don't know whether they've done anything or not because I don't see any signs yet. And when it comes to misinformation, this is one of those things. As I said, kidney disease statistics or the cancer statistics are being manipulated to show that this is a issue unconnected to hill country.
Doctor, now it's very clear the cause of the kidney disease and cause of the problem and how it's happened, why some people are misinterpreting the data. So according to your knowledge, according to your advice, how do we go about it? I have two questions to you. One is, the thing is, what is the main problem that you are facing to present this data to the relevant authority, like the agriculture minister or the health minister or health authority, because this seems to be a major problem. That is number one. And the number two, what is your advice that how do we take this problem from here, and what should be the way forward to tackle this alarming issue?
Indeed, it is an alarming issue. In the end, it is our civilization itself will be wiped out if we carry on like this. It may be 100, 125, 150. It doesn't matter really. 100 or even 125, 150. The thing is, we are heading in that direction. It is going to dawn on us.
You mean to say how many years it will take that to have a heavy impact on the civilization? Like
100 to 150 years. When I say heavy, the national population could be down to 50%.
Within how many years?
Between 100 and 150 years. And it has begun to happen already. For example, in Nadavachi, in 2016, out of 27 Graminidar divisions had the majority as kidney patients, and some places up to 70%. And we don't know about the cancers or thalassemia. They are bound to have those things. Those societies are not going to rise again. And now, if we look at the kidney disease map of 2014, presented by the Presidential Task Force after the WHO study, and the current map, which is 2022, I think, there's a vast difference. Nearly whole of the dry zone is covered.
With the patients?
Yes, kidney disease.
Right.
We are looking at the kidney disease. That's what they call the kidney disease map. But all the other diseases are in the same place. So, meaning, people can't understand this. Governments can't understand this. Simply looking at the map and saying there is a problem. And also to understand the problem itself. I cannot comprehend their mindset. In the past, they would have thought, we'll get away with it. Don't upset the people, don't panic, we'll solve it. If we go on like this, we simply cannot. And more rice fields become toxic in time to come with the new irrigation schemes, etc. And more of the rice coming from Rajarata will be toxic in Colombo, and Colombo will be affected in a bad way. Another, I suppose, 20 years, 30 years in that time. What I claim seems to be unbelievable, more than certain, that we are heading towards that.
So what's your advice that how do we tackle the problem, and what has to be done immediately and also long term, short term? How do we pressurize, or how do we bring this message to the government or the relevant authority in order to overcome, or in order to stop this very, very serious health issue in the country?
From the point of view of pressurizing, we need to inform the public of the crisis. Not only Colombo people, but the Rajarata people too, farmers too, so that they can take whatever measures to protect themselves and the family. And when I mentioned this to a politician quite a while ago, and he said, make a public awareness. I've been trying my best, but they don't want to know. Even now, they don't want to acknowledge. From the practical point of view, we must begin to protect the children, first of all, and then the pregnant, then the lactating in that category of people. And by giving them very clean food. And I say give them, I don't necessarily mean that give them free of charge. No, make sure that it is quality food. That is what's important. And for the whole country, we must have a diet, or in this case rice, I would say the main item, quality control program. And for Colombo and countries in the wet zone, for example, the supermarket rice quality could be controlled, but it need not be at a very high level. But when it comes to Rajarata, the rice zone, it has to be at a higher, meaning it must be more stringent. And when it comes to children, their mothers, etc., I would say we need to go for ultra clean food.
Okay, doctor, now there is another issue with the new government coming, and now there is a crisis in the country for the rice shortage, and there are different stories. Some people say that there's no shortage and they want to increase the price, so therefore they are hiding the rice. And same time, government has taken a decision to import the rice, mainly from India. So when we get the rice in India, we don't have a way of checking the quality control, especially the custom is now saying that you don't have to be worried about it and the quality is being assured. What is your idea on contamination on that kind of a food, and has that also has to be monitored, and the control, the heavy metals and all that in it, because we don't know what we are getting.
Absolutely. For a long time I've been saying that whatever rice we import must be quality assured. From certain countries we should not import. For example, Bangladesh. We know that there's a big problem there. And India, in certain parts there's a problem, but nothing like we have here. So from some parts of India, rice could be saved. But we need to quality assure. I believe Bangladesh rice is safer. They use water from deep wells. They don't have agricultural activity in the proximity of paddy fields like we have in Sri Lanka. And also they don't have tanks, etc., to collect water and do that type of thing. We must quality assure whatever we import. But for that to happen, the authorities must admit that there's a problem. Now the thing is, no kidney disease, no cancers, nothing, there's no problem. With that mindset, we can't go forward. First, we must admit the problem. I must say, before the elections, now the candidate, Disanayak at the time, he mentioned this issue and saying that how the leader of the family, the man of the family, when he fell ill with kidney disease, how he committed suicide, not to burden the rest of the family. I have seen it, it drags everyone down. Not only that, if one person fell ill with a kidney disease or cancer or whatever, there's bound to be others falling down the line. So I hope the president would take this on board and address it, because I believe he's in charge of agriculture. And I only hope he would address this properly and others would not get in the way. It's a big problem. But if you do not address, it's going to destroy us.
Okay, doctor, thank you very much for sharing your time with us and to talk about this serious issue. So we'll try to broadcast these recordings and see how the government or the authorities related to this will take action or whether collaborate to find the solution for this very, very serious issue which is affecting the Sri Lankan population and the civilization. Thank you very much, doctor.
Thank you.